Hello, everyone. Thank you for giving me this opportunity as a speaker in TAIT webinar. My name is Dong-Sub Choi. I am a gynecologist and the founder of Choi-Sang Women's Clinic located in Seoul, Korea. I am practicing interventional treatments on uterine and ovarian diseases. Today, I will talk about HIFU treatment for uterine diseases like uterine fibroids and adenomyosis. The principle of HIFU is focusing energy to a point. It is very similar to making fire with a magnifying glass. And coagulation necrosis of the tumor happens by this treatment. This is a lens-type US-guided HIFU transducer that I use in my clinic. It makes the high-intense ultrasound wave and it concentrates it to a point. The lens-type HIFU transducer makes an accurate and small focal point, so the efficiency and accuracy of ablation is generally very high. HIFU systems can be classified by the method of guidance. Usually they are by MR or ultrasound. We call them MR guided HIFU or US guided HIFU. HIFU can be used to treat many kinds of uterine diseases. We also use it for treatment of endometriosis of abdominal wall or retained placentas. But usually we use to treat uterine fibroids and adenomyosis. Today, I will talk about these two commonly treated diseases. This is a real uterine specimen of two women who had each uterine fibroid and adenomyosis. They are usually benign uterine diseases and had different histological findings. Grossly, they can be distinguished by its margins. As you can see here, the uterine fibroids has a definite margin with their normal muscle layers. But adenomyosis has an ambiguous margin with the normal structures. This is a T2-weighted MR image of the normal uterus and a woman with a uterine fibroid. But in this normal uterine image, you can see the endometrium and the covering smooth and normal appearing myometrium. The right picture here is a patient with a uterine myoma. You can see a well-demarcated global lesion originating from the myometrium of the uterus. This is an image of a patient with adenomyosis. She has an enlarged myometrium with hemorrhagic spots inside the myometrium. Uterine fibroid and adenomyosis treatment options is, there are many kinds of treatments, usually surgical treatments or interventional treatments or medical treatments. Surgical treatments are invasive but curable. We can do operative myomectomy or hysterectomy. Interventional treatments are non-invasive and also curable. We have radiofrequency ablation or uterine artery embolization or HIFU, high-intensity focused ultrasound. We can also use medical treatments in some cases, but they are not invasive, but they are not also curable. We use medicines like ulipristal acetate or ruprololin or etc. When we do HIFU treatment for uterine diseases, the patient must lie in a prone position like this. Theoretically, focal points gather to make lines, and lines gather to make slices. And finally, slices gather to make a volume of necrosis. But actually, energy is accumulated, and when it exceeds the critical point, it explodes to make a volume of necrosis, which is observed as a hyperechoic appearance by the guiding ultrasound. Symptoms of uterine fibroid and adenomyosis is similar and usually classified as 4. The first is pain, like dysmenorrhea, pelvic pain, or back pain. The second is bleeding, like menorrhagia or spotting. The third is mass effect. It occurs frequency or constipation. Subfertility is also can be a problem, like implantation difficulties or uterine peristalsis disorders. The goal of HIFU treatment is making high therapeutic outcome and in the same time giving minimal impact on pregnancy. High therapeutic outcome means high symptom relief and also at the same time high uterine volume reduction. These two go together usually. The approvals of HIFU for uterine fibroid begins at 2013. The KFDA, the Korean FDA, approved ultrasound-guided HIFU for uterine fibroids and adenomyosis treatment. And on 2015, the United States FDA approved MR-guided HIFU for women who wanted to maintain fertility. And on 2016, Korean Society of Obstetrics and Gynecology made a HIFU treatment guideline. And on 2019, UK NICE also made a guideline for US-guided HIFU for uterine fibroid treatment. To check the results of HIFU treatment, we use contrast-enhanced ultrasound or MR images before and after HIFU. The non-perfusion volume, the NPV, is the ablated and necrotized volume. This is a contrast-enhanced ultrasound. The NPV by contrast-enhanced images is nearly identical with the histological necrotic area. We can also predict the damage of normal uterine structures like the endometrium. This is a contrast-enhanced MR image. We can distinguish viable and non-viable tissue by the enhancement or not. So to achieve high therapeutic outcome, many studies suggest NPV ratio more than 80%. Many researchers also found that NPV ratio more than 80% result in superior clinical symptoms improvement and also superior volume reduction. So the more NPV, the better therapeutic outcome, which means more uterine volume reduction, more symptom relief, and the less chance of re-intervention. This figure was reported on 2015, which shows that higher NPV gives more better clinical successes. This is a submucosal fibroid, and just after HIFU, you can see nearly the total volume is necrotized. So the NPV ratio is way over 80%. So we can predict this patient will have good volume reduction and symptom improvement. This patient had an 8.6 centimeter size hypervascular submucosal fibroid. In 6 months, the volume reduction from about 267 cubic centimeters to 132. The reduction rate was nearly 50% in 6 months. Symptom score decreased from 86 to 25. That's about 70% decrease of symptoms. This patient with multiple fibroids had good NPV also. The uterine size decreased 41% and the symptom decreased almost 72%. The next disease that is treated by HIFU is adenomyosis. Adenomyosis is defined as presence of ectopic glandular tissue in the muscle layer of the uterus. The only definite treatment is hysterectomy. Hysterectomy can compromise women's health and fertility in many ways, so we need an effective and less invasive alternative treatment like HIFU. As I previously mentioned, adenomyosis has a poor margin with the normal structure of the uterus, like the endometrium and the junctional zone. The function of endometrium and junctional zone is sperm transfer, embryo implantation, and also uterine peristalsis. So it may be important to preserve the endometrium and junctional zone for maintaining fertility. Planning HIFU treatment for patients with adenomyosis must be conscious of whether we need to preserve the endometrium or not. For further pregnancy, we have to preserve the endometrium, and for high therapeutic outcome, we must ablate the entire lesion, including the endometrium. This is an image before and after HIFU who wanted further pregnancy. The contrast enhanced ultrasound shows necrotic area which does not involve the endometrium. This patient also wanted to conceive in the future, so preserving the endometrium was necessary instead of achieving maximum NPV. And also this patient preserved the endometrium for further pregnancy. But this patient didn't want to preserve her fertility, so the ablation was done to the entire adenomyotic lesion, including the endometrium. Severe symptoms like pain and heavy menstrual bleeding decreased dramatically. And we have to be aware of complications. Chungsan Medical University Hospital in Taiwan reported their experience of HIFU treatment for 4 years and the complications. They had totally 25 cases of complications after HIFU, and most of them were mild to moderate complications that subsided in a few days, like sacral pain or skin blisters. So as a conclusion, HIFU is an effective, safe, and non-invasive treatment to manage uterine fibroids and adenomyosis. The goal of HIFU is to increase therapeutic outcome, and it is important to achieve NPV more than 80%. Future childbearing is not an absolute contraindication for HIFU, but endometrial sparing may be important.